everyone, and welcome to our second hashtag Teal Talk Digital Ulcers, a Patient Experience. We are so pleased to see you all today, and we have two wonderful support group facilitators and people living with scleroderma to share their personal stories on life with digital ulcers. As you will learn today, their journeys are very different, and you will experience their stories of strength today. And with that, a reminder that the National Scleroderma Foundation in no way endorses any drug treatments, clinical trials, or studies referenced in this session. Information is provided to keep the community informed. Because the manifestations and severity of scleroderma vary among individuals, personalized medical management is essential. Therefore, it is strongly recommended that all drugs and treatment be discussed with your healthcare provider team for proper evaluation and treatment. I am so pleased to welcome our two panelists, Debbie Charlton of San Antonio, Texas, and Debbie Morris of St. Louis, Missouri. Both of them will introduce themselves in further detail once we get into the discussion. I have a series of questions. Both of them will answer. And at the conclusion of our call, we will take questions. Please hold any and all questions until that time. Also, during this conversation, we will share some photos that document their real life experience. Please be aware that some of these photos may be difficult for some of our attendees. We are sharing these photos not to cause alarm, but to reflect our reality. We also hope you take to heart from seeing where we are today and how we've managed and overcome these symptoms. I also want to remind you about our next hashtag Teal Talk for next week's hashtag Teal Talk. Welcome to Jan's Home, Daily Living Aids in Action. Registration is still open and it's going to be a great session where you can see how our community member, Jan Nitti, has made many great modifications for her home to help her daily with her limited arm mobility due to scleroderma. Without, uh, Also, I'm Amanda Lippincott, and I am on the patient advisory board, and I'm just so happy to be able to talk with our panelists today. So without further ado, I will kick it over to Debbie Morris and then Debbie Charlton to introduce themselves.
Good afternoon. My name is Debbie Morris, and I am the support group facilitator in St. Louis, like Amanda had mentioned. And I was diagnosed like in 2000, 2001 with scleroderma crest. And at that time, I was just having a lot of swelling in my hands and different things. But the main thing I had problems with was my swallowing, which was strange. And I've just pretty much off and on had several hand issues along the way. But hopefully, with everything we're going to discuss today with you, it'll help you also, as much as it has helped me and or Debbie. So I guess that's the main thing. I really didn't have many issues with my hands for about a year after my diagnosis.
Thanks, Debbie, for your introduction. I was diagnosed in 1999 with scleroderma. I had skin involvement, organ involvement. My main issue are my hands. I started almost immediately with hand involvement, misdiagnosed as carpal tunnel, and it wasn't carpal tunnel. It was the vascular flow was not working the way we needed it to be. So I did a series of appendectomies, was my first experience. Then the digital ulcers came along. So I'll go into further detail about where I started and where I am today with my treatments, pros and cons, and things like that. So thank all of you for taking the time. This is a very dear to my heart, this topic, because of my journey. And like I said, I'll go into further detail about that. So thank you for taking the time to join us today.
Right. And with that, we will start getting into the questions. Um, First, can you share the treatments and surgeries you have undergone regarding the digital ulcers?
Okay, well, I've had a few different things done. When I was my first sore seemed to be very severe. It just came on kind of suddenly, and that's what happens a lot that I know myself, just learning about everything. I probably didn't address everything quite as quickly as I should, and before long, I had a full-blown sore on the middle finger on my left hand. I went to dermatologist. I was seen by vascular surgeons, and everybody always wanted to do a little procedure. And well, as you know, if you've ever had these, they're just so horribly painful, and you really didn't want anyone doing any work. And I was always concerned, thinking, is this really going to help? Or is this going to make that sore worse? How is the healing? Since my healing didn't appear to be very good as it was in my hand. So they just, first of all, they did was a debridement where they kind of numb the area a little bit, and they take, it's all, no, I don't know how to describe it. It's almost like a scalpel, like a Bard Parker blade is on this handle, and they just kind of scrape away at the tissue. And what they're trying to accomplish at that point is to open that up, get that kind of flake the dead layers of skin off there to encourage, a better blood flow. And when they would do that, a lot of the area around that tip of my finger looked very good. I mean, you could see the blood and everything, the blood supply. So they bandage it all up and it would be okay for a while. But then because of my compromised circulation, we'd kind of be right back in the same spot. So after several times of doing that and trying different things and medications, they would, what they ended up doing was doing an MRI and like a CT scan on my hands just to see what kind of blood flow or what had been, because with scleroderma, it changes your vessels and your arteries and everything so much, narrows them. And pretty soon they just don't function like they should. And it causes the skin, like if you nick your finger or do anything like that, it causes the ulcer to just start at that point. So what they did after all the tests, they finally decided that my finger was completely occluded, meaning no blood supply at all. So with those tests, the vascular surgeon that I went to decided to remove the tip of my finger. And he didn't do like the first knuckle, it wasn't quite to the second knuckle. And after he, did everything, I never, until just this year, I had a little sore there. But since 2005, when my finger was amputated, I've never had a problem on that finger at all. It was like a miracle. I thought, thank goodness. And so I really tried to just keep up with, doing things that I should do with my hands. The second thing is I just had surgery in February this year, and they did what they called an venous arterialization. And what they do, they open up your arm and he turns the veins, and it's almost like he's programming your arm by moving all the vessels, and the blood flow goes into your hands more. So this opens everything up and increases that you can feel a pulse in between each of my fingers. Um, he took care of that. And then I also had a ulcer on the tip of my finger, which they tried to treat with wound care, debridements, and finally, when I was in the hospital, what they did was they did another MRI and they found out I had osteomyelitis. So at that point, I had to have the tip of my thumb removed because otherwise it would have spread to my finger or possibly to more of, my hand. So right now it's doing pretty good. I'm still healing. I have still a lot of swelling. And as far as I know, there have been like three different, I'm like the third or fourth lady. I think I'm the third lady here in St. Louis to have ever had it done. So I'm really praying and believing that, this is going to help. It seems like it is. It's healed the ulcer, on pretty much on my finger and everything. So I'm really hoping that, I'm really hoping that this is going to be all I really have to do on my left hand, but I feel blessed to, every day is a blessing, and I feel blessed to have been able to find this doctor, and hopefully it works out well because our plans are to do my right hand in August. So, but
Wow.
that's pretty much everything.
That's interesting, Debbie. Thanks for sharing that. Um, I've never heard of that treatment before where they go on the arm like that. That's new
Mm-mm.
to me, but
I
that's
haven't
great
either.
that they have that.
Yeah.
The treatments and surgeries that I've had, starting at the beginning of my issues with digital ulcers, like I said, was a sympathectomy to help the vascular flow.
Mm-hmm.
Um, I've had numerous debridements. I've even done the hyperbaric chamber treatments. I've
Mm-hmm.
also was one of the first patients here in Texas at the Hand Center to have a stem cell treatment that saved my finger from full amputation. I know everybody's different. That's our motto with scleroderma. Everybody's different with your ulcers, the complications, and so forth. I know a lot of patients that I've talked to have mentioned, well, Debbie, why do you get the calcinosis rocks removed when they're just going to grow back? Well, as you know, as a scleroderma patient, not only with our fingers, the quality of life that we
Yeah,
deal with, and whatever we can do to give us that little bit of a better quality. Now, I can
absolutely.
tell you the surgeries that I've had, I've been blessed that my fingers are not clubbed, but I'll give you an example. This finger here was bent. It was bent and curling and cutting into my ring finger. It was
Mm.
crooked. I had a pin put in the finger to straighten it out with the understanding I may never be able to bend that finger again. So after having that pin in there for about 2+ years, my finger rejected that pin. So we removed the pin, lost the fingernail and all that good stuff. But look at my finger today. I'm able to bend it. I'm able, to utilize it and so forth. Again, not every patient is the same. But what I can't emphasize enough, the treatment and the surgeries that I've had, being proactive, has helped me with where I am today. Now, when I was first diagnosed, the very first treatment I did, I was in physical therapy for 2 years. I had my hands soaked in paraffin wax. I had my web space massaged. I had the knuckles straightened out, just the general measures for 2 solid years that
Mm.
helped stop the progression of the
Mhm.
clubbing, if you will, and all
Mhm.
these other issues. So you may not think that that treatment is necessary unless you're having major problems.
Mhm.
It's preventive. It's preventive. A lot of my treatments that I've had have been preventive. So those are a lot of the treatments and the surgeries that I've had with my digital ulcers. General measures is key on how we take care of those. And that's a whole nother Zoom meeting on talking about general measures. But with the
Yeah.
surgeries, like I said, I've had the hyperbaric chamber, I've had stem cell treatment, I've had debridement, and I've had the sympendectomies is what I've had to help with my digital ulcers is what I've had. And then I can go into detail about other things as we go along. But as far as that question, those are the treatments that I've had with my issues, with my digital ulcers. Okay.
Thank you both so much for sharing. Um, I know you kind of hit on it a little bit, but were there any treatments for the digital ulcers that were not helpful? I think it'd be great to hear your experience on that as well.
Okay. Well, like I was saying before, the debridements, they seem like they help for a while, but they usually, I mean, especially on that finger, came back. I never had other debridements. I was pretty fortunate. Like Debbie said, we have to take care of it. It's something that needs to be addressed as soon as we notice something. I mean, we can't even ignore just like a little paper cut can be a full-blown infection, such a problem so quickly. And if you can just, you know, be very conscious of what you're doing, and a lot of it is you've got to keep your hands warm. You have to, take good care of them and wear gloves, and it's a lot, but it's worth it because the ulcers, I think, are just one of the worst things. I mean, it's just that they're debilitating. If any of you have had them and, suffered through it, it's just like you can't imagine how could this hurt so bad, this little, piece of whatever on my thumb or my fingers, anything. It is ischemic pain. It's because of all the nerve endings and everything in your hands, and everything. But the debridement didn't work. I have had what they called Flolan infusions, and those, I had one like for 5 days 10 years ago, and they were amazing and they worked very well. Now, this year, when all this was going on in February with this infection, they did infusions for 5 days again, and I really didn't notice anything. And I don't know if that's because I was having all the problems that I was having, but there are so many, things that they can try, and they're all well worth it. It doesn't always sound real nice and it doesn't always make you feel better, but it's definitely worth the try, to get some healing or to feel better, because these ulcers not only are the fingertips, they can be the knuckles, the joints in your wrist. I mean, they can be so many places. And, we just have to kind of do the best we can do. But definitely, if you have anything starting, have someone see you right away. I mean, we'll go over some things about treatments and different things we've used, but definitely do something ASAP because it's very important.
Thanks,
Okay.
Deb. That was
Mhm.
great.
Thank you.
Oh, the $1,000,000 question, what did not work? Well, what did not work for me was the hyperbaric chamber treatment. That did not work
Mm.
at all.
Mm.
Not only did that not work, it scared the bejeebies out of me because you have to psych yourself out being in that. We had an
Mm.
old-fashioned one here in San Antonio, but that did not work for me at all. Um, I have been very successful with the treatments that I have received, but
Mm-hmm.
but the one that has not worked for me was that particular one.
Particular one.
I also have had the IV phone-in
Mm-hmm.
treatment with Dr. Mays in Houston. I was in ICU because it is a very powerful treatment.
Yes.
Don't let that scare you, people. Don't let that
Mm-mm.
scare you.
They
I was
want you.
very well taken care of when I had that treatment, and it was very successful for me. It really was. So I think I contribute a lot of these treatments um, that I've had to my success with where I'm at today with my fingers. So, as far as the question is concerned, the hyperbaric chamber treatment did not work for me with my digital ulcers. But then, like Debbie mentioned, we will go on into other parts of our treatments and daily rituals, if you will,
Yeah.
as we go along in this meeting.
Mhm. Mhm.
Actually, on that, what was really helpful in terms of treatments that you had for digital ulcers? Great
Glad you
segue,
asked.
Debbie.
Yeah.
Debbie Morris, you want to go first with what was successful with you? Because I've got a
Sure.
list this long.
Yeah. Well, I mean, it was a treatment. But I guess it's a treatment, even though I had my finger removed, the tip of it, but it was wonderful to have relief. And maybe that sounds strange, have your finger removed, but it's like it's so awful sometimes all you want to do is have it stop so you can resume some kind of normal every day, because it completely takes your life over as far as I'm concerned. And I'm sure Debbie will agree, at times it's just unbelievably painful, and you just feel bad, and you're constantly changing bandages, and it's just like, I think a lot of it is, it takes a while, and you're hoping that it would be a little quicker, but it isn't. But I think that helped me. And I also, before I ever had I'm sorry, I had the amputation in 2005, so I had sympathectomies. I had like four sympathectomies, and I truly believe from that point, right after I had the amputation up until this all started, that it really helped. It really saved my hands. It I mean, Dr. Gelberman is down at Barnes Hospital. It's a big teaching hospital here in St. Louis, and he was wonderful. And he says, no, we're going to do these two first, and then in a couple of weeks we're going to do the other ones. And they make an incision in the palm of your hand, and what they do is go in and try to open up the vessels to allow the blood to flow. And it is uncomfortable, but it seems to me like it starts working pretty quickly. At least it did for me. And I had a couple small little ulcers, and they healed pretty quickly within a couple weeks. So I think the sympathectomy definitely was a blessing for me. That, and hate to say it, but the amputation, but it did take the problem away. And at that point, there wasn't really anything else they could do. I mean, it was complete, no blood flow, and it would have just became very necrotic and turning bad colors and everything, and it would have had to have come off at some time. So I'm just thankful that they were able to do that and help me with that. But I did appreciate, and I really think that sympathectomies worked well.
Thank you, Debbie. And they do. And they do. And let me emphasize on that. The vascular flow is what causes a lot of our issues, you guys.
Mm-hmm.
And these digital ulcers are not only on our digits. I get them on my ear. I get them on my elbows, and so
Yes.
So, Amanda, the things that have helped, the treatments that have helped, let me backtrack. One treatment that did not help was Botox. I don't know if any of you have ever heard about Botox for
I had that.
Raynaud's. I had that, and God bless my doctor, because that injection on my hands, no bueno. That was the most excruciating pain ever. Now, I can tell you, the debridements that I've received, I've tried doing them in the doctor's office. No can do. Every surgery that I have for debridement, I will go into the hospital for the day and get it done. I drive to Houston. It's an in and out procedure, and I'm good to go. The only time that I've had difficulty was when this finger was charcoal black. I mean, it literally looked like a piece of charcoal. The treatment that was done on this finger was the stem cell treatment. I had the representatives from the manufacturing company, from the stem cell company, come out and witness the treatment. And that helped the growth of the skin, and that kept it from a full amputation. I just lost the tip. Now, I can't emphasize enough how important it is when you first start with just like a paper cut, how important it is not to ignore that and how to treat it. What I do to help keep it from getting infected is I soak my fingers in an antibacterial wash, is what I do. Pros and cons. Some doctors will tell you keep it dry. True, you want to keep it dry. However, this treatment that I do myself, if there's any pus involved, any infection involved, it drains it and it dries it out. Works for me, may not work for you. It is crucial to go to a doctor that knows about scleroderma and hand care, a surgeon that knows about scleroderma and wound care. A wound care specialist wants to cut, cut, cut. A surgeon in general wants to cut, cut, cut. Our type of situation, the least you cut into our bodies, the better off that we are because we know how we heal. So let's get that clear. However, when it comes to saving your finger, you want to welcome the cut, but you want to welcome the surgery from somebody that knows what they're doing. And that's why we're here today, to help you guys understand what works for us. We're here for you. You can always reach out to us. So yes, the debridements that I've had have saved my fingers. The beginning stages of my diagnosis, having the massage. My husband was a practicing attorney at the time that had PI cases. We were fortunate to have a therapist that does this type of physical therapy. So you can contact your rheumatologist, your PCP, and tell them, look, my skin's tight. I need help. I need massaging. I can show you general measures that I do to help massage that web space and so forth. But as far as the treatments from a medical profession, make sure that your doctor knows of scleroderma and that you're not getting cut into for no reason. For no reason. Now, when you develop the little calcium rocks, okay, I will soak my fingers and remove them myself. I have developed a little toolkit with certain tools that I use to remove the rocks and soak them and so forth. I'm fortunate to be able to do that. Some of you may not be, and I get that. But these are general measures that I do for my treatment that have helped me. So the first sign of infection, I soak my fingers in the antibacterial wash and start working on it. If I'm not successful with that, I call my hand surgeon that specializes in scleroderma. He's actually been on our medical advisory board back when we were the Bluebonnet chapter, and I let him know I've done my general measures. They don't work. I need help. Okay, so don't, if you can't do general measures on your own, that's fine. Nobody's telling you to take these measures into your own hands. These are just tips that work for me. But don't be afraid to ask. Don't be afraid to reach out. Don't be afraid to ask any questions. No question is too silly. These are your fingers, you guys, and we don't take care of these things. You know how fast that can go south. And I'm talking about the daily discomforts that we have with just the skin burning. What I do is I use tubular gauze. I don't use Band-Aids. Band-Aids are too painful for my hands. I use tubular gauze. Okay, so what do you do with the tubular gauze? I cut it, I put it on my finger, and I twist it around, and I pamper that finger. When it starts just burning, irritating, pamper that sucker because something's brewing. Something's brewing, and you would be amazed how it stops the irritation. Ask your doctors about hand splints. I will show you later on in this series where I've had literally skin, meat, tissue sticking out. So I'll put that splint on to help protect it. And I mean, anything is people may say, "Oh, you're overreacting. You just have a little paper cut." No, you're not overreacting. That little paper cut can cause you an amputation if it's not taken care of. So these general measures that I am more than willing to share with you, reach out to me and give you my email address. And then we can go on with the doctors that I see, later on in the question and answer. But those are the treatments that work for me, are the general measures that I do, medically going to a doctor that specializes in scleroderma and hand care, and having the debridements and having the calcium rocks removed are crucial. Yes, they do grow back. Yes, they do. I've been fortunate that they don't go back to the extent where infection has reoccurred, and that's key. So again, your doctor may tell you, don't waste your time, don't have it removed, it's going to grow back. You don't know that. Everybody's different. So whatever we can do to help our quality of life, that's the road we want to go down. So those are the treatments that's worked for me. Hyperbaric chamber treatment did not work, and Botox did not work for me. Did not work. So we can go on to the next one, Amanda.
Thank you both for sharing. Can you tell us where you are now in regards to your hands and digital ulcers?
Well, I think I'm doing pretty well. I'm just anxious to have some of the swelling go away. But he said I could have some swelling in my hand. My arm healed very quickly, very easily, and I had over 41 sutures in my hand and then my thumb. And you just have to be patient, and I'm trying to be. But he said a lot of the swelling will stay around sometimes, 5 to 6 months. So hoping that, every day it seems I can bend my hands a little, my fingers a little bit better, and that it's not. But I'll tell you that one thing is when he removed that part of my thumb and everything, and the procedure was completed, I didn't have that terrible, terrible pain in my hand any longer. So, it really does show me and tell me that, it's all about the circulation. It's about how the blood flow is to your extremities and everything. And it makes such a difference. I remember before we did the surgery, I wasn't even like sleeping. I mean, I would lay there just in so much pain and everything every night. And even Mark, he's my significant other, he even told the doctors, whatever you can do to help her. She needs to sleep. She needs to rest. She's lost weight. And, it was very, very difficult, but I really feel like I'm doing well right now and just trying to always be very mindful of paying attention to my hands and other things also, because like Debbie said, she had that calcium. I early on when I was first diagnosed, I had a real problem with calcium in my elbows, and I don't know why. Same way, trying to get them up, because otherwise you get cellulitis and your arm would blow up. So there's just, I think, with us being compromised, immune compromised and everything, and we have all these things going on within our body, I think we just have to be very careful and always remember when we don't feel good or something bothers us or our hands or whatever, that we need to be sure we do something and keep a close eye on things, because we're not like everybody else having scleroderma. We have to fight through a lot of things and be sure, that we're doing the best we can for ourselves. And I hope by us being on here today, we've helped you guys and maybe at least gave you some ideas to help yourself in that. And I feel the same way. If you want our email to talk back and forth or have any questions, I'm happy to do that also. So I
Thank you,
think
Debbie.
that's mm-hmm.
That's good. So where am I at today? Well, okay. I have my thumb actually has a bone infection in it. And I discovered that when I was doing my nails, that all of the bottom of my nail had turned into mush. And then it was tender for a couple of days and it started losing. So I soaked it. I called my hand surgeon and I said, look, I've got this going on. So he said, we did an MRI. It showed infection. And then we thought, okay, we're going to start 6 weeks with IV antibiotics. And I said, no, that's going to take my summer. I can't. My summers are too precious. So I said, let's try the oral meds. So I'm happy to report my thumb is doing very well with the general measures. We have it under control, and communication is key with your doctors. Now, every day, you guys, we have issues with our fingers every day. That's just from here on out. How I deal with that, I have a lot of bad words that I use on a daily basis from bumping my fingers. Sometimes I'm not such a nice person. And the thing that I learned about this disease, if you're not having a good day, warn your family and put yourself in timeout, because every day is a challenge. No matter how my fingers look, I know I'm very blessed to have the mobility that I have in my fingers. And that's my journey to share with you guys, to try to help and give you some of the blessings that have been bestowed upon me. And that's what they are. If I feel an ulcer coming up, like I said, general measures, and I'll pamper it. No day is a good day for us, but we make the best of it with the best that we know how. So again, general measures, wrapping them, pampering them, and just trying to do the best that we can is where I'm at today with mine. The minute I see something coming up, I nip it in the rear end and take care of it. So the infections never end. They come and they go. And that's why we need to band together and help each other. How do we get through these hurdles? It's just something that we, have to deal with on a day-to-day basis. So that's where I'm at today. Not happy I have bone infection, but we're managing it. And that's the best that we can do. That's the best that we can do.
Thank you both. So what is the single greatest piece of advice you would give someone with scleroderma who is starting to struggle with digital ulcers?
Well, I would say just keep on top of everything. Be sure you're being very careful about everything you're doing with your hands. Take care of them as soon as, like Debbie and I have both said, you have to be sure they're cared for right away. Just like if it was your baby. I mean, if you don't get in there and do something about them, it can just slip away from you so quickly. And it's definitely, it's definitely not worth it to, ignore, that's for sure. Well, you really can't ignore them because they'll come back with a vengeance. So, but the best thing to do is pay attention to everything that, happens, everything you do with your hands. And I think also that comes with, I don't know if we're going to, I think next we will talk about a few different things that we use and things we do. But I think that the most important thing is that you pay attention, treat these problems, these fingers right away, and stay on top of it. Be sure that everything is, and if it starts looking bad to where you don't think what you're trying to accomplish, everything that you do, it's not getting better, then you do need to call your doctor right away. I have a wound care doctor that I see. And I mean, he'll get me in just like that and tells me, have you done this, this, and this? And I said, yes. And so it's very important. Got to take care of ourselves, head to toe.
Good advice, Deb. And I can tell you, for people that are just starting out with digital ulcers, you know how we have to be advocates for our bodies, for scleroderma. Be advocates for your fingers. Don't take any little cut lightly at all.
Yes.
Just pay attention to your body as you do with your fingers. Listen to your fingers, and ask questions. Questions. You get a slight cut on your finger, pay attention to that cut. Make sure that you pamper it. Like I said, tubular gauze works the best for me. If you have an ulcer that is oozing or that is open, I use a zero form so it doesn't stick to my tubular gauze, because the main thing you want to do is save the scabs, the trying to form and so forth. The list is endless of things that you can do. But for those of you that are new patients, that are new to digital ulcers, that are experiencing those, please don't take those lightly. and consult your PCP, consult your rheumatologist, your infectious disease doctor, whomever, but whoever you consult, please ask that $1 million question. How many patients have you dealt with that have scleroderma? How many patients have you dealt with that have digital ulcers? Those are questions that need to be asked. You owe that to yourself to make sure that you ask those questions. So yeah, newly diagnosed, starting to have problems with your fingers, get help as soon as you can, and make sure you take care of those so they don't turn into major infections and so forth.
That was absolutely great advice. Were there any gloves, tool, or over-the-counter products that helped with managing your activities and daily living?
Yeah, yes, there were quite a few. One thing I wanted to mention about is before I start is there was a article one time on Mayo Clinic, and I had requested some information from them, and they sent me something, and I know when I first read it, I thought, they said to avoid stress. Well, yeah, okay. But anyway, scleroderma makes you stressful. What are they talking about? But anyway, they talked about that to reduce stress, what's cold, keep yourself warm, wear layers of clothing, any of these things to help with, wear socks, be sure your hands are covered and everything. And then I actually received another printout the other day that it was the scleroderma research. It's something I subscribed to online, and it had the same information on there. But talking about different things that help, I know I've used different, like salve or different, things that the doctors have given me and stuff I use, and I always wear gloves. I also like hand warmers, some of those, like I've got some here, the hot hands. I'm sure you guys have seen them. A lot of times you can get them at like Bass Pro in different places, but I use those a lot. And wristies. I don't know if everyone is familiar with wristies, but they're it's kind of I don't want to call it. It's a warm little pocket that you can stick your hand in, and your thumb is out. It's like that. And you can put one of those little heating pads inside of there. There's a pocket inside of them, and they come in a small, I know it's hard to see, small, and then also you have a long one, a larger one. It goes further up your arm, and they come in all different colors and everything. I use those, and I also have a couple different hand warmers that I use. It's like a pocket hand warmer. It's only about that big. And I can actually slip it around my wrist and stick it in my glove. So I like those, and it's all battery operated. Or I think this one comes with a little charger you just plug into like your phone. And that is from, I believe that one was from Amazon. And this one I have not even used yet because I have another one, but it's also a rechargeable hand warmer. And a lot of times when you purchase them, this one is by, it's a Coupa. It's OCOOPA. And they're hand warmers that you can actually put inside or just sit, read a book or sit and watch TV. But it really helps a lot. It does, it brings a lot of comfort and everything. But also warm gloves. I have a heated vest and a heated jacket and heated like camo gloves my three stepsons gave me, but they're all rechargeable and it works well. And that's the main thing, is to keep everything warm. And it really does help with your circulation and everything. But there are a lot of different products out there that, that we can benefit from and help with all the problems we have with the ulcers and the way our fingers sometimes want to bend and, things like that. But did you, I don't know if you wanted to discuss anything as far as any cream or antibiotic, because most of the things, well, one is prescription, but a lot of things are over the counter, that they suggest using also. At least my wound care did. So I don't know. Debbie, if you want to do your part, or we can talk about that if we have enough time, but
Okay, and I'll be quick. I have a lot of little toys.
yeah.
One thing that I have, I don't know if y'all are familiar with a can opener that is on.
Yes, I
It's
have that.
by Kitchen Mama. You just lay it on the can. Means you just lay it on the can and push the button, and it does it on its own. So that's one of my little tools that I use to help. I keep talking about an antiseptic wash. I don't know, Ashley, can we show products or yes, no, or I'm not sure. Okay, we can show products, but like I said, we're not endorsing anything. We're not giving medical advice. I'm showing you what works for me. This has lidocaine in it. This is what I use to soak my fingers in with warm water. Now, I put maybe about a third of a cup. There we go. About a third of a cup of this lidocaine with warm water, and I'll put my whole hand in there. I put my whole hand in there and I just soak them. The minute you get that little paper cut, so to speak, the minute you get the burning sensation, the minute they're achy, this will soothe them. I talked about tubular gauze instead of Band-Aids. Go to your medical supply store. You can get it online. I buy this tubular gauze that I use. I cut it. I have a little thing that I use, but I loaned it out to a patient. And what you do is you put this on the finger. Now, I'm able to do this, guys. Don't get discouraged. I know a lot of patients aren't able to do this, but I will put my finger, even if, like I said, paper cut, just the burning sensation, twist it around, cut it, twist it around, bring it back, and then wrap it with this. My mind goes blank. Jiminy Cricket, such a basic name.
Coban.
Thank you, Deb. Coban.
And it comes in numerous colors.
Yeah, and wrap it around your finger to hold it in place. Now, do not, if you have an ulcer on your knuckle, do not put the Coban on top of the ulcer or the area that is affected. Okay? Okay. Question now. What happens if you're oozing, if it's open, Zeroform? Your PCP, any doctor can prescribe you Zeroform. Cut a little piece of that, put it on there, and then put that on there, and it protects. I developed a little kit that I use with scissors, tweezers, antiseptics in there that I keep with me. Another thing that I use is we all use these little hand grippers to open your cans and so forth. Another thing, paraffin wax machine, especially if you're newly diagnosed, the achiness from the joint. I use a paraffin wax machine. We can do a later class and I can show you how I do it by myself. That helps with the vascular flow. That helps soften the tissue. It helps with the joint pain. Pros and cons. I never use it with an open ulcer. I've had conversations with patients that do. Again, we're not here to give medical advice. I'm just telling you what works for me and etc. But these are some of the tools that I use. Also, I cannot open my energy drink, the soda where you pop the thing.
Tab.
The tab, thanks, Deb. So this deal here that we got way back in 1909 when we were the Bluebonnet chapter, it has this little thing here that you can use to open your cans with. So this is a little tool that I kept, and it helps. I use this on a day basis. It even has a little gadget on here to open the things, but that's a whole nother ball game, you guys, that we can have a session on gadgets and tools and stuff like that. But I cannot emphasize enough, especially to the newly diagnosed that are just starting out with ulcers and so forth, paraffin wax machine. Paraffin wax machine. People get ulcers on their toes, on their feet, same concept. Soak it in there and take it out, remove the wax, reuse it, so forth. helps tremendously with the vascular flow. So these are my little toys that I use to help me get through on a day-to-day basis. Is what I use. So thank you.
Debbie, did you want to share the creams that you use, or we do have some questions from the chat, so
Okay. Well, the only thing I had,
for selling food.
yeah, I had this. I wanted to show this. I use this all the time, like Debbie said. I have one of those. Didn't we have something like that at one of the conferences where they gave us the round one or something? I don't remember. Yeah. And anyway, I use that, but I also use this one. It's a contraption. I don't know if you can see it, but as long as you can squeeze, there's some days when I don't even have that much strength, so it doesn't work good. So Mark does that for me. But other than that, it's, these are very helpful also. The one thing that I used for a while, and I didn't know if I was going to mention it or not, because I used it kind of the first couple little ulcers I had because a very dear friend of mine she's had scleroderma ulcer. Her name was Karen, and she also had a lot of ulcers and problems. And she had went to one of the doctors at Barnes Hospital also, and they told her to use, it's called silver hydrosol. And it is it like fights off bacterial infections, and it improves the condition in your fingers, and it more or less it cleanses the wound. It's almost, I always considered it to be like a debridement itself, and it's just in a little bottle, and it's a dropper. But you can also take this orally for your health and stuff and for your immune system, but I've never used it for that. But I did find some relief, and a lot of times that helped. Now, I can't say that I've used it much since then, but I was using it early on in my diagnosis. But it's supposed to boost your skin health, so it definitely does help with these ulcers. But like we discussed, everyone is different. Some things, medication I might take might not work good for Debbie or Mary or someone else. It just depends on you. We do have a lot of medication that a lot of medication that they use for blood pressure that they give patients to help us with our circulation and things like that. And that's pretty much everything that I take is, things like that it's for my blood pressure. So I have to be kind of careful when I take them if they increase or try to change anything. Sometimes my blood pressure is low anyway, and it kind of makes it drop even more so. But there are, I think more and more things that they're coming up with all the time to help us. But I think, we're still a long way from the answer, that's for sure. I mean, as far as these ulcers and things, I just feel like, it'd be great to have more research on everything, everything about scleroderma. So, but
That's true. Yeah. But
that's
some of the
pretty
things that I
much
do,
everything other than, I'm sorry, I keep forgetting. I keep looking at my little tubes here. This is what the doctor gave me the last time. It's called Bactracin. Yeah. And this stuff really helped with the discomfort too and the healing. And this is something that he gave me, and I, use that quite often. And then I was reading some information. I went on Mayo Clinic again, and then a Cleveland Clinic. I was just looking up some things because I always figure, I get emails all the time, but I don't know everything, and I'm sure I'm not getting all the information I might need or want. And they talked about Manuka honey,
mhm.
and it's a medical grade. And I've been using that because I had another little stinker start on this hand that wasn't hasn't had the surgery, and it's really doing well. So I'm keeping that manuka on my right hand for now to see. I've been taking some photos just to see the healing process and what may work better, but those are just a few things. But always check with your physicians. We're not here to tell you you need to use this and but you can look things up online and find out a lot of information about it. So I hope some things work for you all and help to improve things for sure. Okay.
Thank you. So we have a little bit of time. There were a couple of really great questions in the chat. One was, can you please restate the name or the type of venous arterial surgery mentioned?
Okay. It was called venous arterialization. And let me spell that out. Yeah, gosh. I know I had it written down before we started. Now I'm thinking, what was the paper did I put it on? But it's like arterial and then lization, Lization. Now, I don't know for sure how many physicians are doing this. I don't, like Debbie has a very excellent surgeon, a hand specialist that she works for. I don't know if if anybody else has been doing this, but like I said, before I had my surgery, I actually saw two previous patients that had it done, and thank you, Ashley, and had it done, and then he showed me photos of each patient, how their hands were, the Raynaud's was so severe. And I think the one lady may have had some surgery on one of her fingers, but he showed me before and after on, and it was amazing. Yeah, it really was. I pretty much just sat there and cried because I thought, oh my gosh, if I could have that. But yeah, it was kind of, I think now, after having it all and seeing it right after it happened, it was a lot, it was a lot. It was a lot to kind of go through and just see. And he actually showed me pictures of the surgery when he was doing it. So I could kind of see. And that was like, wow, that didn't bother me as much as seeing my arm afterwards. But um, I really, he's just a very sweet and kind man, and I couldn't be more thankful to have met him. But it was, being down at Barnes, and they do a lot of, they're doing so much research and everything all the time, and I don't know for sure I could find out, but I'm thinking maybe that he actually himself came up with this procedure after studying and seeing patients with him, because you know what, I actually asked him my last visit, because I've seen patients online and on the different scleroderma sites and stuff asking for help for feet or their knees and different things, sores they've gotten on their legs. And I asked him, do you ever do anything like that for lower extremities? And he said, no, I haven't, but I'm wondering if that would be possible with everything, because of our healing and different things. But like I said, my arm healed in no time. I mean, it was so quick. My thumb, not so much. That's where he removed it, but it was, I don't know. It was poor circulation before we started, but it's healed now. But I just wonder. So I don't know. He might be thinking about it. I don't know. But I'd love to see that happen for people that would need something like that. So, okay.
Thanks. So we actually had two requests. Mary Blades, who's a board member, wanted to share something, and then someone had also asked to see Debbie's toolkit. So maybe we could do a little show and tell.
Nice.
I want to show you my muffin my grandson gave me for Christmas. It was the best Christmas
Cute.
gift I got. I wear this when I go to the doctor's office because my hands get so cold,
Cold.
and
Yeah.
I can actually put it over
Hmm.
or just carry it. I love it. It's not so heavy like a winter muffin is. It's
Mm-hmm.
a lighter one, but the inside is so warm. And
Nice.
and I can put a hand warmer in it.
Oh, yeah.
So
That's
I
nice.
just wanted to show that because I'm so proud of it. And it keeps my hands warm.
Yeah.
I take it to the store. I take it everywhere.
Oh, that's cool.
I know people look at me weird, but who cares?
Who cares?
Thanks. Thanks, guys.
Thank you.
Okay, I can show you my toolkit. It's really a
Hmm.
first aid kit that I got at Walgreens. Okay, and I kind of personalized it, is what I did. I added some little bitty alcohol swabs because before I use any little tweezer or scissor, I always disinfect in it. Okay, in here I have the scissors that come with it to cut my tubular gauze. Like I tell you, I do my own maintenance on my fingers when I get a calcium rock. So after soaking it, I have these tweezers that I use. I think I might have them, yeah. And they have a little, they're very, very pointy. And this is what I use, if you can see the tip on those, maybe not, to get the calcium rocks out. Now you have to be very careful with these guys because they're very pointy and you can hurt yourself. So this is basically what I keep in my toolkit. I just have different sizes of tweezers and etc. to fit whatever need I'm utilizing them for at the time. So I just keep this handy wherever I go. One of the things I wanted to mention, somebody asked about, do you go to occupational therapy or physical therapy? It would fall under the category of occupational because this is what you're doing to help with your lifestyle. If it was physical therapy, it'd be more like a broken leg or, something like that. Occupational is helping you survive on a day-to-day basis. And so that's what I went to. Um, Another thing I want to emphasize is uh, I do wear gloves every time I go to the grocery store. I've been told to keeping your neck warm helps keep your whole body temperature warm. So that's another thing. And I walk around in ski socks and sweats year round. So that helps with the Raynaud's as well, and so forth. But occupational therapist is the way to go. And you can talk to your PCP about that. You can talk to your rheumatologist about that, is what you can do.
Well, thank you so much. We are past the 3 o'clock time, but this was absolutely amazing. So wonderful to hear both Debbie Morris and Debbie Charlton's experience. It, is so uplifting to see, you both thriving even while dealing with digital ulcers. So thank you both so much. And thank you everyone for attending our Teal Talk. Don't forget to sign up for next week's Teal Talk, and thank you all again.
Thank you, everybody.
Thank you. Thanks for attending. We appreciate it.
Bye-bye.
Bye.
Bye-bye.